Then how do you define a person who is having a depressions? Depressions also call the thought process which is cannot be expressible is called as a depressions. What do you think either about your career or futures or about your health or in other regions? What do you think it is that you don't express it for a chronic periods of time, for long periods of time, that will cause you the slow process of the aging of the brain. So that is called depressions. This, what is the cause exactly? There are multiple factors which cause you depressions. At present scenario, the primary cause of the depression is more of financial crisis or this secondary is any kind of dispute or dilemma in the family or personal life. And third scenario is the professional stress. This is major three contributors for the causing the stress, and obviously if it does not express that, you don't find a remedy for that, that goes to the depressions. So depressions and once again the thought process or the imagination or the process what is going through inside your mind, you don't express it, you don't find a resolution for that, that you will term as a depressions. Then what it lead to be in primary stage? It will lead to first things will give you mild bit of anxieties, your behaviorality, the environment disturbance within your surroundings, peers and colleagues or in the families. Second stage. Then third stage, it will have your little this sleep disturbance, with lack of sleep, that's called insomnia. Then slowly you will have this one. Then in next step, you will have the deterioration of the decision making the skills. Then the next step, we will go to the stage of the dementia. That's called decline of the memory. So this is called as a chronic procedure. It does not happen overnight or a 1 week or 10 days or 15 days. We have the long term which can cause you. But why does it happen all these symptoms slowly? What happens this one actually in during the depressions? So supposing the normal life, the regular life, what do you think it is? The brains, the cerebral keeps on working in that regions, particularly in that aspect, in that subject. Then the second step, you need to find a solution for that. So, or express with someone. So that way, what even though you don't find a solution for that, at least express with someone. So that will lead to the decrease in the signals of the traffic inside your brain, that is in cerebral parenchyma. So so then what happened? This one then brain at least will become the healthier structures. But you don't express it. So slowly what happened? Even also you'll see the ideal. So the brain will keep on functioning in that aspect what you thought it for a long time, which will be stored in your memory. So that keep on this go functioning, and brain will start executing that functions, because brain function is in that way. When you will take any in given input, brain has to execute in that. That is brain functions. Brain will start executing. We need to give input for that. in what way you need to execute it. But meanwhile, if you don't get any solutions, so brain will start getting slowly getting exhausted. If you don't express it, if you don't execute it, brain will start getting exhausted. So the brain cells will in the normal things, it will take it easy. Normal MRI will be cells, brain cells, this is a completely healthy brain cells. But if you slowly you will start getting this one, brain will also getting exhausted. Then what happened? The thickness of the brain parenchyma will start getting slowly hypertrophy. So that strengths or this overall the healthy parenchyma will start getting deteriorated. So in the other way, you can see the other MRI findings, which will really give you this kind of, this is called mild kind of getting atrophy of the brain parenchyma. So then in the chronic, if you overall this mild things, so it does not give you in this extent, it gives little bit of headache and mild anxieties. Yeah, obviously little bit of behavior disorders. They will have very few cases will have the decline in your decision making skills. But in case of it lead to the further, suppose, then what it does, it is to give an expression in this. See, think about these conditions. So this will slowly then overlap with diffuse atrophy that will also sometimes in chronic cases will give you ischemic changes that will because the place of the blood circulation exactly does not happen the blood circulation less, but this one consumption of the brain parenchyma it will be high because the execution level it is high level than the normal as usual things. So there will be input of the blood supply will be that normal extent, but your brain exercise it in high extent. So obviously there will be imbalance in the blood circulations. So brain needs more, but our heart pumps it is as usually normal level. Then that is called ischemic changes will happen in the cerebral parenchyma. So that is called the aging process of the brain. So aging process, that is what happens in the case of elder peoples. That's called they reach age of cross 70. At present 70, 75, they will start brain getting atrophied. So that's what we call the normal aging process. But this is called this is unusual aging process that is causes major is your depressions. So then what happens it is how to avoid it is, so depressions obviously first we start giving this one antidepressants. But again antidepressant what it does it again. So antidepressants will suppress this acetylcholine's binding process, or it blocks the signal which transmit from the pre to post synaptic junctions. Post synaptic in the synaptic junctions, the external block. So again, obviously you are suppressing the nervous system functions. First, always the persons are the this one in the loss of because cerebral parenchyma. But again, second you are giving antidepressants. Again, it will block the anti-neuron junctions. So again, further we are deteriorating. So that is primary treatment for this. It is obviously counseling, psychological support. Then find out the root cause, what the patient, how he has the depressions. Meanwhile, so patient will have the solution for that, rectify that issues, find out what is the root cause, then gives more counseling and support. So that will be the best treatment. Even also you will add with this one nootropics, that is also still is more better with stimulant. Mild of this one with nootropics. So that will maintain the brain cellular parenchymas, and patient will have the natural and best way to come out from the depressions. So that is first kind of approach. You will also see you don't achieve in that way, still patient have the anxiety, you will also giving the nootropics, then you will have the mild bit of CNS stimulants, but still the person does not come out from that, then you don't have an alternative putting in antidepressants, because that is final stage. So antidepressants like the final stage in women's what patient is cognitive function has much deteriorated more than 60 to 70%. Like in example, whatever patient talks into, it does not have a give you meaningful things in society, like the screamings or sudden crying, laughing, all the kind of will have the abnormal behaviors. So that will give you need to put have the antidepressants. That is in the chronic stage, which is cannot be reversible with only counseling. You have to give. But to avoid that, again to suppress that this one, you have to add on CNS stimulants. It is very essential. We need to put, sometimes we need to put the acetylcholics, which gives more cholinergic actions. This one to does not allow to deplete further the CH brain cerebral parenchymas, etc. And simultaneously we will have the antidepressants programs. So that will give the long-term solutions for that. Yeah, additional supplements will have the obviously will have the vitamin B12 and D, uh, then antioxidants, that is very essential also. So slowly we'll start the patient will start a better relief, but top of that with medication, counseling, behavior modifications with the main part of this one, meanwhile solution for the root cause, where and how he patient develop the depressions. That is very essential, but because unless until we don't find a solution for that, again they will have the recurrent depressions, because that is the main courageous toward the patient landed with this problem. So this is very important factors. Then slowly monitor the patient activity lifestyles. Then after that we don't need to put any antidepressant things. Okay. Thank you.